Welcome back to Africa Science Focus, the weekly science and development show from SciDevNet. I'm Ogechi Ekeanyanwu. The World Health Organization says antimicrobial resistance, a situation where bacteria, viruses, fungi, and parasites evolve and no longer react to medicines, is one of the top 10 public health threats in the world. Antimicrobial resistance means that infections become hard to treat or outrightly incurable, which then leads to large-scale deaths. Sub-Saharan Africa, like many other parts of the world, struggle with diseases being resistant to medicines. One major challenge that the region has in tackling antimicrobial resistance is with getting data it needs to tackle the problem. Without the right kind of data, it is difficult to see the extent of the problem and to understand what interventions are necessary to control antimicrobial resistance and treat infectious diseases. Our reporter, Michael Kaloki, spoke to Dr. Pascale Ondoa, a virologist and Director of Science and New Initiative at the African Society for Laboratory Medicine. Dr. Ondoa has been telling us about antimicrobial resistance and why it is such a concern.
It is a phenomenon through which a microbe, a pathogen, and in the case of our recent study, a common bacteria, loses the ability to respond to the medication that previously used to work to control the infection caused by this bacteria. That is resistance. And the reason why antimicrobial resistance is a concern is that because the microbe, the bacteria becomes resistant, it becomes more difficult then to control the infection with the medication that used to work. And that can cause some problems to the patient, more complication of the infections. I mean, they stay a longer time sick or in the hospital. That's what we call the morbidity. There can be higher mortality rates. And of course, for the society as a whole, it costs more money to control those infections.
What impact have these diseases had in sub-Saharan Africa?
We know from recent study that around 1.3 million of deaths are caused by antimicrobial resistance bacteria, and most of this burden is in Africa and West Africa because there's also a high exposure to infectious pathogens. The World Health Organization has a system that they call the Global Antimicrobial Resistance Surveillance System, GLASS. And they propose to follow some priority pathogen. At the time we started, there were 8 priority pathogens and 15 combination of those pathogens with antibiotics that are relevant and that should be followed. So why this list? This list is really to guide us in gathering relevant intelligence on what are the pathogens out there that are really critical.
Many factors have led to increasing numbers of antimicrobial resistant germs. Dr. Yewande Alimi is the Antimicrobial Resistance and One Health Program Coordinator at the Africa Centers for Disease Control and Prevention. Dr. Alimi spoke to us about what led to the rise in antimicrobial resistance.
There has been over-reliance on antibiotics across the countries and primarily because of several factors or several challenges in the health system. For example, when a patient presents with fever, for example, in a hospital, the cost of diagnostics has been very expensive, and most of the time the doctors and the patient are faced with the choice of do we go to do the routine tests or do we start on any antibiotic available? Most of the time, because many of our African countries, healthcare delivery is pay out of pocket. Most of the time, the patient and clinicians prefer to go for the cheaper option, which ultimately is as the antibiotics. So many times, clinicians don't go through that process of doing the routine tests, the routine tests are needed before prescribing. So many times you find many clinicians or doctors just relying directly on antibiotics. But beyond issues around the cost of diagnostics are very common across low and middle income country is really the gaps in the weak healthcare systems. The fact that we don't have sustainable healthcare funding is where you start to see the gaps, where you start to see the gaps in testing, laboratory testing, and AML surveillance. But beyond that, it's also the gaps around the regulatory systems. Like you rightly said, is there an over-reliance on antibiotics? We have very weak regulatory systems. So there's always the presence of over-the-counter sales of antimicrobials. So many times you can just walk into a pharmacy without a prescription and you're able to get this high-end antibiotics. This it really puts a lot of there's a lot of use of antibiotics because of course patients can easily get it over the counter without any prescription. Really, those are the key factors around the over-reliance on antibiotics across the region. There is that the cost of the testing versus the cost of the antibiotics. Oftentimes, the antibiotics is cheaper for the patient to use than going for the routine test. So what we really need to improve the system is we need stronger healthcare systems and we need more sustainable healthcare funding in this regard.
The issue of antimicrobial resistance is predicted to get worse, resulting in poor patient outcomes and death. Dr. Ondoa has been researching how antimicrobial resistant germs are being tested for in Sub-Saharan Africa. She spoke to us about what this research has uncovered about antimicrobial resistance on the continent.
We wanted to understand why is there so little antimicrobial resistance information from the African continent. Is it that we cannot produce the information, or we produce the information and we do not report it? And I think the answer to that question that came from that study is that there are extremely few, a very little number of laboratories on the continents that are actually doing bacteriology testing, which is what we use to identify antimicrobial resistance. Only 1 in 100 laboratories can do bacteriology testing. We understood that there are very few opportunities out there on the continent to generate this information. Another highlight that we found is that out of the 15 bacteria and antibiotic combination that is important to monitor for surveillance, only 5 of those are routinely tested collectively by the bacteriology laboratories in Africa. So therefore, the information is not coming. We also understood that when the information from the laboratory is coming, it is not properly linked to information from the patient. So why was the patient sick, whether or not he took already some treatment. So it becomes then very difficult to make an interpretation of the laboratory data in the context of patient care and public health surveillance. And finally, the third point was about the utilization and the consumption of antibiotics. And we realized that collectively in the countries where we did that study, there are issues on accessing essential antibiotics. We understood that the larger part of the consumption of antibiotic is represented only by 3 type of molecules, which really means that African countries do not have access to the large, the broad list of antibiotics that is out there. And at the same time, we identify that many drugs that are unregulated circulates in Africa, which really poses the problem of regulation.
Now, you mentioned there that there are a few laboratories only that are carrying out these tests out of the laboratories that are available in the region. So why is this the case? Why is it that only a few laboratories are covering this and are able to test?
The lack of testing for bacteriology. So first of all, I think that bacteriology testing, bacteriology laboratory have not specifically been prioritized by the health system on our continent. It's not been, for example, prioritized as, HIV testing or tuberculosis testing have been prioritized through very well funded vertical programs. So that's a first problem. Now, for the few laboratories that are out there testing for bacteriology, they test really a very narrow spectrum of what they should be doing. And it is, that really reflects the lack of capacity or resources, possibly the fact that the reagent that they need to isolate and identify the bacteria are not there because there are problems with supply chain or there are problems with resources. It is possible that the human resources lacks the skills. Some pathogens are notoriously more difficult to identify than others. And that could be the problems. Some pathogens can be, identified from urine, other from blood, other from other fluids, and this is more or less difficult, and not everywhere you have the skills to actually conduct the scientific process in the lab to identify those bacteria. There could be a lack of awareness in the lab, but also from the clinicians that do not ask for the correct test and diagnostic to the laboratories. And finally, in the list of WHO pathogens, although this list is very relevant, some of the pathogens that are recommended by the WHO might not be as relevant for the African settings, which poses the question of whether or not the list could be slightly adapted to the context.
What can be done, or what is being done, to eradicate these pathogens in the Sub-Saharan Africa region and the wider African continent?
That has several several perspectives. So the pathogen themselves, whether they would be resistance or not resistance, whether we can eradicate them. I mean, some pathogens can be eradicated. Malaria, for example, could be eradicated in some part of the continent, although malaria is a parasite and not a bacteria. So I think we'll continue to be exposed to those pathogens. A very effective way to eradicate some of those pathogens is, of course, vaccine. So there are vaccines against bacterial meningitis, for example. There are vaccines that are being developed against salmonella infection. So I think that increasing vaccine coverage for those bacteria that can be preventable by the vaccine will be critical, and poses the question of ensuring access to essential medical products for African countries. Detection, quick and reliable detection of infection, the cause for infection in patient is critical. So that would mean, increasing the number of laboratories that are capable of bacteriology and other testing. It's very important to understand quickly what is the cause of infection, so that you can manage the patient coming with a fever. You can quickly manage them with the right treatment, so that they don't stay a long time in the hospital. They have a reduced risk of mortality, and that you decrease the risk for the emergence of antimicrobial resistance. And at the level of hospital settings, for those infections that can be very serious in the hospital setting, I think increase and consolidate the measures for infection prevention and control, make sure that good practices, good hygiene practices are being done in the hospital settings.
That's all from us at Africa Science Focus today. If you want to find out more, head to the SciDevNet website. That's www.scidev.net. Today's show was produced by Alice Hurst, with reporting by Michael Kaluki and editing and hosting by Ogechi Ekeanyao. Until next time, goodbye. Africa Science Focus is produced by SciDevNet and distributed in association with your local radio station.